So I'm just going to, as we are going through, obviously this meeting is being recorded, but if you would just tell us who you are, your name, and your organization. Thank you so much. And anybody can get started.
Corey Hatchett from House of Refuge International Church, part of the BHSB board and part of the GBRICS Council.
Thank you, Corey. Welcome.
Good evening. This is Kathy Greason. I'm here tonight on behalf of Maria Harris Tilden with Care First, and she will hopefully be joining us as soon as she is able.
Thank you, Kathy.
Hi, Sunny Schnitzer, Baltimore City Mayor's Office.
Wonderful. Thank you.
Trisha Roddy, the Medicaid program.
Thank you.
Sue Doyle, Carroll County Local Behavioral Health Authority.
Thank you, Sue.
Lee Elmock, Baltimore County Local Behavioral Health Authority.
Wonderful. Thank you, Lee. I know that there are some others. I saw some introductions in the chat. Anybody else who wants to go up?
Sharon McLarnon, LifeBridge Health.
Thank you, Sharon.
Brian Hepburn, National Association of State Mental Health Program Directors.
Wonderful. Thank you, Brian.
Good evening, everyone. Angela Cooper from Mercy Medical Center.
Thanks, Angela.
Katie Rouse, Honored of Maryland.
Wonderful.
Good evening, everyone. Ryan Moran, MedStar Health.
Hey, Ryan. I saw you, Krista, with the hello. Thank you. Anybody else who has not introduced themselves or put their name and information in the chat? Okay. Okay, wonderful. I see we still have folks joining. Thank you, Kimberly.
Hi, it's Dina Stout from MedStar Health.
Thank you, Dana. Nice to see you. Good stuff, good stuff. So I'll tell you what, we are going to, I do want to remind you, and I think I said it earlier, if you jump in and we've not heard from you, please put your name and organization in the chat and we will make sure that we receive that. Thank you, Brian. Good to see you. Hey, Dan Rabbit. We are going to go ahead and review the agenda and we'll go ahead and get started. So we've done obviously welcome and introductions. We're going to talk a little bit about sustainability planning, specifically a GBRICS policy agenda, GBRICS Community Engagement Committee report, council work for the rest of the year, and then we'll do announcements, closings, and remarks. And so we won't, I promise we will not belabor any of the points. I believe we will have some robust discussion today, so super excited about that. But before we go on to our agenda, if we could, I just would like to just really talk a little bit about Gregory Riddick. I know many of you, obviously his face is on the screen, and just really want to talk about his life and his legacy and his commitment to this work. And so many of you know him. He was an advocate and champion for the rights of and voices of people in the community. And after losing his son to gun violence, that really put voice to what he does and his work, what he did, and his dedication. He dedicated his life to helping others understand the impact of trauma on individuals and communities, in all communities. And so he was a peer recovery trainer. He ran grief support groups with Roberta's House, and obviously was the executive director of the Trill Foundation. And in addition to helping individuals process grief and heal from trauma, he really was actively working to change systems to be more trauma responsive and equitable. And so he worked with BHSB on behavioral health reforms, specifically the consent decree, and he was actively working with GBRICS. And so to make sure that changes in behavioral health crisis services met the needs of the communities in Baltimore. So his passing really has been and is a blow to us in the community, but we are at GBRICS and corporately and individually, really committed to carrying out his legacy. And so I just want to share a poem that really speaks to his values that we all share. And so, as you notice, I'll put my glasses on because now I'm not as young as I once was. First impressions, judging a book by its cover. So when you look at me, what do you see? Do I live up to the expectations of how you think I should be? I have self-respect and I have dignity. So I really don't care what you think about me. So if I went to your level and tried to impress, do you really think that I would pass the test? Come on and get real. Here's a word to the wise. I could really be God's angel in disguise. So you say, it's not about color, it's not about race, but you can look into my eyes and lie to my face. I'm sure that you could, but that's neither here nor there. So here's a word wig for you, for your head to wear. It's not about how a person looks, it's about the inner person, the heart of the book. I mean, would you buy something because of what you see, or would you inspect it for quality? Now that is the way that things should be, not something based on fantasy. So now is the time for us to open our eyes and air out our minds and let us stop looking how a person is dressing and not get caught up on first impressions. And so if we could just take a moment of silence, I think again, it speaks to who he was as a man, who he was as an activist, and who he was as an advocate. Thank you all so much. And thank you for indulging us and giving us the opportunity for be able to do that as a moment of personal privilege. So thank you so much. And so for the moment, most of you have probably been waiting for, and I will yield to Nikki on this. I think we are probably ready for the policy agenda, at least to start to have the discussion.
Thank you, Andrea, and thank you for the moving tribute to Mr. Riddick. And I think that is really a nice segue into the policy agenda, because let us take that approach as we look at crisis services and sustainability, and approach this problem as a collective problem for us to solve, and not any one individual or stakeholder's problem. This is something that we collectively need to come together. Everybody's voice matters, and it's something we all serve a role in ensuring that this hard work that we're doing here to really enhance crisis services in the region, that it's sustainable. So I think that you know that that sort of is a key component of GBRICS is sustainability. And we have identified policy advocacy as a key strategy for sustainability. There are things that we will need to advocate for policy change. And so at the May and July council meetings, we discussed some policy considerations for sustainability, and these considerations provide guidance to the GBRICS Policy and Advocacy Committee, and to help us decide and figure out how we're going to focus our efforts in driving a policy agenda forward. And we don't want to solve all of the world's problems with behavioral health. We're really trying to focus on sustainability for GBRICS. While there are many gaps in the behavioral health system, we are focusing on GBRICS and sustainability. They're not all crisis services. And so, we developed this agenda with a diverse group of stakeholders in mind. Again, knowing that, addressing the needs, mental health and substance use needs of our communities is not any one person's problem to solve, not anyone's group problem to solve. And in fact, more robust crisis service is something that will benefit everyone. And so this policy agenda will guide our work for the next few years. And crisis services are one of the largest access points to the broader crisis system. And it has been underfunded and under-resourced for way too long. So this is really an opportunity to advocate together around the forms that we need around crisis services, and really to make this great work, this project that we have laid the groundwork for, sustainable for long term. So it has a future that really lives beyond those who are working on it today. And with that, I will turn it over to Adrian and the BHSB team to walk us through the policy agenda.
Thanks for framing that up so well, Nikki. So I will be presenting the policy agenda this evening on behalf of the Policy and Advocacy Committee. But like Nikki said, the Policy and Advocacy Committee was a diverse group of stakeholders, which was, and their key charge was to come up with this draft policy agenda to present to the council this evening. In terms of the stakeholder representation on the Policy and Advocacy Committee, it included some council members. So Nikki, Katie Rouse, Mental Health Association of Maryland, Care First, a variety of our hospital partners, MedStar, LifeBridge, they were all kind of at the table. We also had some other stakeholders that were part of the group helping us thinking through, like NCADD of Maryland. They're a group of behavioral health advocates that represent substance use providers. CBH, the Community Behavioral Health Association, they represent mental health providers. So like I said, we tried to include a variety of different voices in the development of this policy agenda. And we also tried to make sure that we had partners at the table that really understood lobbying and really understood advocacy in Annapolis and helping to think through strategy development as well. So like Nikki said, the policy agenda that you received in an email from me includes a range of policy recommendations for sustaining the GBRICS partnership. The policy committee took to heart the advice that we got from the council back in May, which is don't bite off more than you can chew. Make sure that we present an agenda to you that is focused and achievable. And also that it really focuses on sustaining the GBRICS components and not, suggesting reforms for the entire behavioral health system, right? We are responsible for several key components through the GBRICS proposal. So the guidance we got from the council in May was make sure that your policy agenda is specific enough and reflects that. So we took that to heart in thinking through how we kind of crafted these recommendations. You'll see in the policy agenda, there is a focus on sustainability and investing in and sustaining these infrastructure investments we're going to make through the GBRICS partnership. So in terms of process for development, the Policy and Advocacy Committee met several times, June through August, to flesh out the proposal and the recommendations that you saw. In addition to that, BHSB did some pretty extensive policy research, again, focused on some of the guidance we got from the council. So looking at where there were opportunities with federal legislation, we examined 988 legislative efforts in a variety of different states, all of which kind of were happening this year. So it was a great opportunity to look at that. We had discussions with national and local experts on how we might approach certain policy initiatives. And then we also shared the policy agenda with the Community Engagement Committee for GBRICS to get their input. The Community Engagement Committee, who you'll hear from later today, is also a really diverse group of stakeholders, partners from grassroots organizations to behavioral health providers and community members. So we thought their input was helpful. Their input generally was, yes, they thought our policy agenda was on the right track in terms of really sustaining GBRICS, but also making reforms in areas where there have not been reforms in a while. So what I'm going to do now is walk you through the policy agenda quickly. Hopefully you've all had a chance to look in it in advance, but you'll see, if you did not, you'll see, and just if you're not, open it up and you'll see that there are two key priority areas for which we've organized our policy recommendations around. One, the first is sustainable and dedicated funding, and then the second is integration to the behavioral health system. So I'll start with the first. We recognize, and through several council conversations that we've had around sustainability for GBRICS, is that sustainability, a lot of it's going to depend on where we can identify dedicated funding for some of the services that we're going to stand up, like, for example, the expanded mobile crisis team services, which have historically been grant funded for decades in the state of Maryland. So there are several recommendations around what we can do to create sustainable funding. The first is around establishing an adequate 988 fund. So this is something hopefully that's familiar to council members by now. We've talked about this a couple times. There is an opportunity in front of us in the state of Maryland to establish a 988 fund, which would create a sustainable funding source or sources for behavioral health crisis services, including the 988, which would be the comprehensive call center, but also the continuum of crisis services. So that's an incredible opportunity. And as we've discussed in previous council meetings, this 988 fund opportunity, or the opportunity to establish one, is an opportunity that we equate to being almost as impactful as the Affordable Care Act several years ago. It's a great opportunity for expanding and sustaining behavioral health crisis services. The second is looking at reimbursing crisis services through Maryland Medicaid. So this is also something we've talked about. This is also something we know that our state is currently in the process of pursuing and planning for. Specifically, you'll see if you looked at the policy recommendation, we're looking at if there are opportunities to use Maryland Medicaid to sustain the mobile crisis team services, which is, again, the one kind of service area through GBRICS that we're looking to expand pretty substantially over the course of these 5 years. And then the third around funding is working with the private carriers to identify opportunities to expand coverage for crisis care. We, through the development of this recommendation, have learned that behavioral health crisis services is a kind of unique niche practice that may be something that's familiar to us, but not necessarily familiar to private carriers. So working with them to identify how we might expand it through that private market is something that I think is an opportunity that's available to us that we'd like to pursue over the course of these 5 years. And then so moving to the second category, integration into the behavioral health system. Like Nikki said earlier, we recognize that behavioral health crisis services are one of the largest access points to that broader system of care. However, our system of care between behavioral health crisis services and then that broader continuum of care is not always smooth and integrated, nor is it well coordinated. And that's one of the things that we're looking to change through GBRICS, in particular with our investment in the software infrastructure or that care traffic control technology you've heard us talk about a couple times. But again, if we make this investment, we've got to sustain it. But we also recognize that integrating integrating behavioral health crisis services with that broader system of care can also start with 988 and designating 988 as Maryland's behavioral health crisis hotline. So right now, a lot of people are, in our opinion, looking at 988 is a little too narrowly, as it's just a phone number you can call for suicide prevention. We know that it can be more than that. It can be a number that we can promote and use to promote into the community and use for a range of behavioral health issues, whether it's somebody who does need help with suicide in the moment, or if it's somebody who's looking to get access to that broader system of care. It's a little bit how our hotlines operate now in the state of Maryland. We have our 24/7 behavioral health hotlines and they get a range of calls, right? Not just people calling in crisis. So we want to look at using 988 as an opportunity to better integrate people to that broader system of care. If people can call it, they can get connected to a range of different types of services, whether it's outpatient care, whether it's being connected to our wellness centers in the community, just as an example. But that's one of the other incredible opportunities that 988 provides for us and at GBRICS, but also for the state of Maryland. And that kind of dovetails with the second recommendation, which is coordinating our crisis system with the larger behavioral health system. And again, that's where the infrastructure investment will be incredibly helpful. We know that once we do have that better infrastructure to support the comprehensive call center, that they will be able to more effectively make referrals and more effectively follow up with people to make sure that they get connected to that ongoing care. Again, helping to improve the coordination and really integrate the crisis services with that broader public behavioral health system. So I'm going to pause now and see if anyone has any quick questions. Otherwise, I'll turn it over to Nikki for discussion.
Questions for Adrienne? Adrienne, I actually have a question, sort of maybe both process and content wise. I think you're looking for the advocacy and policy committee to identify the strategies, the timing, when to move forward with certain things. Really, the question for this group is high level. Are these the right policy? Is this the right policy agenda? Correct?
Yes.
Okay.
That's right.
Any questions for Adrian? Or any other members of the policy committee? Okay, well, with that, if there's no specific questions for Adrian, let's take some time to talk about this agenda as a group.
Nikki, I do see that Kathy Grayson has her hand raised.
Okay, great.
Thank you so much, Nikki and Adrian. I wasn't sure if I should jump in now or later. Care First was a late member to join the policy committee. So first wanted to just express gratitude to Adrian for letting us join late in the game and for her patience in bringing us up to speed on all the great work that had gone into the document. But as the council reviews the recommendations, I just wanted to flag a few issues that we did flag for Adrian on behalf of Maria, who will hopefully be joining us soon. So both of our comments are in the first item, build and sustain capacity through dedicated funding. So 2 points that we shared with Adrian here that we proffer for consideration. One of the recommendations is to ensure private carriers cover and reimburse for certain behavioral health crisis response services. I don't know if it's possible to jump back to that slide, just so I'm not reading to folks.
Yep.
Thank you so much. What we flagged here is the way this is crafted, which is very broad, which I think was intentional after discussing with Adrian. We're concerned that it may generate some pushback from the payer community because of its breadth. So when you're talking about the commercial market, you're talking about 17% of the market that can be regulated by state law. And so within this, you've got your private payers dealing with a number of regulations when it comes to mandates. So the Affordable Care Act limits the imposition of new mandates, for example. We're constantly looking at costs, and with a broad proposition like this, it was really hard for us to give feedback like, yes, we should definitely be covering that, or yes, we're already covering it today. So what we suggested to Adrian was, and we offer to be a resource as well, is should we do a deeper dive into what's being covered today in the commercial market in this area, and where maybe the gaps are, and how can payers be a resource to the council in providing that information, so that as this policy recommendation maybe turns into legislation at some point, the council has a better sense of what the landscape looks like. Our biggest fear, obviously, we're very supportive of the work that GBRICS is doing, and we don't want to be in the uncomfortable position of seeing a troubling provision that's not, this is maybe a little more ancillary to the goal of the council, and having to engage in that legislation in that way. So wanted to just flag that for the council as it deliberates. And then the only other issue we wanted to flag was we wanted to recommend the addition of another provision in the dedicated funding section, specifically just from our internal review of some of the other states that have adopted this type of model. It's our understanding that the cost savings from reducing ER visits is substantial in the hospital setting. And so we would recommend that the council look at whether or not hospitals can contribute some of that cost savings back into the program when looking at sustainability of the program in the long term. So I thought I would just flag those now, and for my colleagues on the policy committee, and would be happy to speak further on those points if anyone has questions.
Thank you, Kathy, for those points. And to your second point, let me speak to your second point, to hospital funding, and I think it's a great point, and I think you're right. And I think hospitals have gone at this work with the intention of, because this is all being funded through rate dollars now, that if this is a demonstrated model that, as expected, reduces ED utilization, reduces some inpatient admissions, then hospitals should be a seat at the table in sustainability. And so I agree with you, and I think there are ways to work with the HSCRC to outline that. that policy. I think maybe one thing we should, sort of a caveat for all of us who are engaged in this work, as all of us as stakeholders, our goal is sustainability for a successful model, right? And so I don't think anybody's, we're going into this with the assumption that we will be successful, and I know that we will be, but I think that's a key thing for us to continue to remind ourselves, right? The long-term sustainability of a successful model. But to my hospital colleagues, I welcome your input on, having hospital funding being part of this. I agree with that point, and I do think that hospitals, sort of being the first at the table of this initiative, had gone at this work with that assumption. It had always been, our desire that it shouldn't be only the hospitals that fund it for long-term sustainability. So welcome input from the other hospitals. And then let's, after we have a discussion on that point, let's return to the first point that you raised. Any input, any thoughts around having, sort of recognizing that hospitals will also contribute to long-term sustainability through reductions in ED and other utilization. Deanna, I think you're talking, but you're on mute.
Yeah, sorry. This is Dina Stout from MedStar, and I just want to be careful with this piece as it relates to the other HSCRC policies that already reduce our revenue based on volume reduction. So I support it. We just need to make sure that we're not double paying because of the other HSCRC policies that are also driven on volume.
Agree, and I think that's something we will have to work with the HSCRC to help ensure that there's the appropriate methodology that would sort of allows that if there is a reduction in utilization, to allow that revenue to stay with the hospitals to invest in the project long term. And I've had those conversations with Dan at BRG about, I know that he's given some thought to what that methodology would look like.
Great, thanks.
Any other thoughts on adding that as a specific policy agenda? I don't think something like that actually will require a legislative change, but it is something that would require an HSCRC methodology, an HSCRC specific methodology. Ben, I see your hand raised. And I can't always see people's hands raised, so please, Adrian, or others from BHSB, keep me on target here.
No, this is great. I just in terms of, I don't think there's anything that necessarily needs to be added to there, but under the coordinate crisis system within the behavioral health system, I think there's a huge opportunity to look at both funding and resources to position these things on the front line. What we're seeing with the behavioral police diversion program, for example, is that there is certainly a paucity of resources positioned on the front line with EMS. And so it'd be really interesting if this initiative would also explore how to integrate things like the crisis intervention training or the BEST training into the first response. So I think it actually gels with what you're talking about here. Just kind of an opportunity to combine initiatives and priorities, especially since we're dealing with some of these things, I think, on a regular basis on the front line from the pre-hospital care standpoint. Thank you, that's all.
Thanks, Ben, for bringing that. But I also, Kathy, I don't want your first point to go without discussion. So speaking specifically, I think, what you were trying to say is for the private coverage of crisis care, that if I understand what your ask is, or the discussion point you have is there a way to potentially narrow that scope, or is it just that we look at that as a priority, but keep in mind that we need to do a deeper dive and an assessment of what's currently covered?
The latter, Nikki, and thank you so much for bringing us back. Just that the way that it's currently drafted, it says to ensure that services are covered broadly, and I just want to make sure we take the opportunity, first of all, to see if there is a non-legislative solution. and make sure if there's a misunderstanding or an administrative issue, that what can we do today to help resolve it, but then further just want to avoid any pushback, from our industry. And so I think the assessment would be a good first step.
I think that's a fair point, and probably something that would be very productive. And I think the assessment of what's currently covered, one of the things we could also look at is sort of, it might give us the opportunity in doing that assessment to also think about what the ROI might be as well. Not that that's sort of a contingent, but probably an opportunity for us to look at that as well. So I think that is a great recommendation. Would love to open it up to the group for discussion. So again, I just want to clarify, you're okay with this being being something that's an advocate on the advocacy agenda, but again, something that doesn't move forward until we do a deeper dive and do assessment of current coverage. What are the opportunities? What might need a change administratively? Just confirming.
Yes, thanks,
Okay.
Nikki. Instead of saying ensure coverage and reimbursement, I think evaluate coverage and reimbursement.
I think that's fair. That sounds reasonable. Thoughts from the group? I realize I should probably keep my opinion to after the discussion. Okay, so I will do that from now on. But I'll let others speak up first before I share my opinion. My apologies for jumping out there. So it doesn't look like there's much for discussion. Any objection to making that change? Okay, then sounds good. Sounds like everybody's okay. Other policy issues for open for discussion? Does this sound like we're on the right track to the group?
Yeah, I think this looks great.
Okay, that's great to hear.
Agreed.
Not hearing it. We're hearing some looks great. No objections. Are the, anything that was overlooked? Anything that we should be adding to this?
This is Kathy Grayson again. Just one more general thought I wanted to ask. Have we done financial projections yet for what it will cost to stand up the model long term, or is that something we're just not really sure at this time? I ask because I feel like any discussion of the best policy avenue for long-term funding will obviously need to consider what is the long-term funding, and then we can evaluate whether the things we've outlined will be sufficient or overly sufficient, or if we need to look for other opportunities.
So Kathy, I'll share my perspective and then turn it over to the BHSB team to speak to the details. As I think for some of these initiatives that we are hoping to establish in GBRICS, the long-term goal is for it to be an actual statewide thing, right? And where are the opportunities for 988 to be a statewide resource and not just a regional resource. So I think some of those projections may be hard until we have a better sense and know sort of, how are we going to position GBRICS not just as a regional resource, but as a statewide resource. But with that, I will turn over to the BHSB team to speak to any specifics.
Nikki, you're right. The only thing I'll add, Kathy, is when we did do the proposal, we did several analysis to try to get a better understanding of what the potential need could be for community-based crisis services. And it's really a huge range. What we want to see is that fewer people are using the emergency departments and fewer people are, calling 911 and having interactions with law enforcement to getting access to our system of care. But I don't think we're going to have a better understanding of what the true need is until we make some of these investments in the comprehensive call center and the infrastructure to support it, and really expand our mobile crisis teams and start to use them in more ways than we have been using them in the past.
Other thoughts or questions or comments about the policy agenda?
I just have,
Yep, go ahead, Sunny.
sorry, I just had one question. Do we think that there's value in getting, in addition to, I guess I'm wondering about the ways we can leverage our local legislative process, whether it's to pass resolutions in support of 988, things like that, and wanted to kind of throw that out there to the group in terms of ways to really bolster our chances of getting any legislative changes that we need to get changed.
Sunny, I see a lot of heads nodding, and I was actually sort of, just before you jumped in, was going to add that I think as we sort of the specifics of when and what we're going to make as the policy agenda, you know, some of those are yet to be known, but we will be relying on all of you as the GBRICS Council and in the areas where, you know, where you may have relationships or expertise to help us advance that policy agenda. And I think you're absolutely right that there's the role, you know, as I said at the beginning, we all have a role in this, and local government has a role as well. Adrian, anything to add to Sunny's comments?
I think that's a great suggestion. Dan, Rabbit, do you have any thoughts on that? Because he's been doing a bulk of our research, so.
I just think it's a great idea. I think passing resolutions in favor of 988 is one way to helping us with the delegations in your different jurisdictions. I think is important. You know, 988 establishing the fund, it's a state level policy, and so the governor and BHA and the legislature is who we really need to move. But I think that is a great idea, and we would love to continue to talk with you, Sunny, and everyone else on the council about how to move that forward. I think we are recognizing that it's particularly establishing the fund and establishing a revenue source for the fund is a heavy lift. And so we're looking at like building a broader coalition beyond the GBRICS region and beyond the GBRICS partners that are currently represented on the Policy and Advocacy Committee. So we're going to be looking at like how to build a strong campaign to move this forward. So it's a great idea, and thank you for bringing it up.
Other thoughts, comments, suggestions? Well, this, I don't think we took the full, what did we have dedicated to this, Adrian? 50 minutes? 40 or 50 minutes. Well, good. That just shows what a collaborative group we are and that we're all very much on the same page. Although before, I guess I should wait till we take the vote before I say that, but from a discussion purpose, it sounds like we're all pretty much aligned and that we're heading in the right direction. One last call for comments, any further discussion? And then if not, let's bring it to a vote. Do I need a motion, Adrian?
Could I ask you a quick question? This is Chuck.
Yeah.
Yeah, so I may have missed this earlier on. Were there plans discussed with what to do with it as we go into the next legislative session? I mean, just sort of some preliminary ideas on how or if, I guess. I think I've heard variations on not doing anything for this cycle. I just was curious if that could be part of the conversation quickly.
So Chuck, I said on the Policy and Advocacy Committee, and so I can tell you that we're still having discussions with state leadership on whether, you know, what our legislative agenda should be this session, if anything. We're trying to be sensitive to the fact that that we're going into an election year, and that, you know, really we don't want sort of a good policy agenda that likely has broad-based support somehow get hijacked by election politics, if that's a good way to say it. So it's we are still sort of vetting this and making sure that we're not putting anything out there that could sort of have unintended consequences at this time.
That makes good sense. I mean, I think that's the gist of what I heard before, but it hasn't changed. I think it makes sense. Thank you.
And we will, we'll certainly report back to the council on what those decisions are by all means. We wouldn't drop a bill without bringing this to the council for discussion, but did want you to know that it's something we're actively discussing with state leadership. And it's just, we haven't come to a conclusion yet. There's still a few more meetings we have to have.
So Nikki, I'm sorry, I might have missed this. This is Trisha Roddy. Are you advocating for legislation to require Medicaid to cover certain services and reimbursement?
No.
Am I on mute? No, I'm unmuted. This is Adrian. Just one thing I'll add, maybe I wasn't very clear in the presentation, is not every policy recommendation leads to legislation. Kind of like Kathy was talking about with her suggestions, there could be regulatory and administrative changes. So not every recommendation leads to legislation.
Any other discussion or questions? All right, Adrian, you're gonna have to remind me. I can't believe I don't remember this, but like, what do we need a motion to take it to a vote?
You have done that in the past.
Okay, yes. Can I have a motion to vote on the policy agenda? The motion to approve.
I so move. It's Andrea.
Second.
Great, thank you. Any opposed? Any opposition?
Nikki, just want to confirm, we're approving subject to the changes we discussed tonight?
Yes, my apologies. Yes, as amended. Okay. If there's no opposition, I think we can go ahead and move forward. Thanks, Adrian. And I believe the next on the agenda is to get a report out from the Community Engagement Committee.
Sure. Yeah. Hi. Good morning, or not good morning. Good evening, everybody. Myself and Jamie Clark will give a update on the GBRICS Community Engagement Committee and the work that we've been doing so far in since we convened earlier this year. The tribute to Mr. Riddick. Apologies for the puppy in the background. Can you get him, please? He's really cute, trust me, but he's a little loud right now. So I was saying is something very solemn. But the tribute to Mr. Riddick this earlier in the meeting was particularly relevant to us since he was a co-chair of the Community Engagement Committee, and so he really helped to get us to where we are today and to really keep us honest and keep us focused on the purpose of the Community Engagement Committee, which is to engage meaningfully with the people that we hope to serve through GBRICS and with robust behavioral health services. So it is very sad. We are very sad at his passing. But Jamie is our other co-chair, our current chair, and she's been great so far. I'll take it to the next slide, please. So just as a reminder of how the Community Engagement Committee fits into our overall community engagement approach, I've been thinking about it in sort of three buckets. We have staff and vendors, but the Community Engagement Committee really coordinates all of this and provides guidance and direction on how we allocate our staff, vendor, and consultant resources. On the BHSB side, I've been staffing the Community Engagement Committee up to this point, along with Diane Stallenwerk, who's a consultant. But we recently hired a new community engagement coordinator who's going to work solely on the GBRICS project. That's her name is Samira Abdul Fattah. I think she might be with us today. She's been on board for a little over a month, I think, 4 or 5 weeks. And so we're really thrilled to have her on board. The other new resource that's coming online is our marketing and communications vendor, which is Marketing for Change. We had a competitive procurement for that, and they were selected. They are a national, well-respected marketing firm and have worked with, I think, SAMHSA and the Horizon Foundation in the past on behavioral health and other behavior change marketing. So with Samira and Marketing for Change coming on board, that's really expanding our resources to help to increase the impact that the community engagement committee and our community engagement efforts can have. The next slide, please. And this is just like a quick other note on Marketing for Change. You know, again, you'll see that little disguise there is from the Howard County Unsweetened campaign that they worked on with the Horizon Foundation to reduce consumption of sugary beverages. Where that's going is they're really getting started now, and we'll do a full market research and message testing process to come up with a campaign to promote GBRICS and 988 and accessing behavioral health services. We hope to have that plan developed by June of next year. And so that's something to look forward to. And the Community Engagement Committee is going to be helping them along the way to get there. So with all that said, I'm going to pass it over to Jamie to go through the founding of the committee and what we've accomplished and where we're headed.
Thanks, Dan. Appreciate it. Good evening, everyone. It's great to see so many familiar names. You have quite the stacked council here. So thank you for all the work that you've done so far to push this project forward. I am currently the Senior Director of Programs and Community Engagement at NAMI Metro Baltimore. And it's not lost on me that, you know, like Dan said, Mr. Riddick really should be here with me presenting this information. His hands are all over our accomplishments so far. And so that's really great to see. And I hope we can do his legacy justice moving forward. We've accomplished a lot in a very short amount of time. We have over 65 committee members who are coordinating GBRICS community engagement across the region. We also developed the formal principles to guide the work of the GBRICS partnership and our community engagement efforts. The committee, we had a subcommittee of members who provided feedback about the language that we were using to describe and market the GBRICS partnership to make sure that it was palatable and understandable to community members. And we created a 6-month timeline as well with a different subgroup that really set us up for success over the next 6 months. We have some pretty ambitious goals for community engagement that we're excited to share with you all. And then we also recently formed local subcommittees of the Community Engagement Committee for each jurisdiction so that we can start planning and organizing these engagement events over the next 6 months. Next slide, please. Thank you. So rather than listing all of our members, because it's a lot of really wonderful people, here are some of the buckets of people that we've convened for this committee. We have peer-led organizations, neighborhood associations, faith leaders, youth advocates. You'll just see that we have a really broad range of people who are represented on this community and will really help us reach deep into these 4 jurisdictions and help us engage community members meaningfully. Thank you. And I believe you all have seen these principles for community engagement. Feel free to correct me if I'm wrong, but I won't belabor them by reading them directly. But really, like Dan said, what we are trying to do is build meaningful relationships, true community partnerships with community members Too often we see that community engagement efforts are one and done. You know, organizations can go into a community, host an event, and then community members may never hear from them again. That's not what we want to do at all. We want to maintain contact and make sure that their voices are heard at every step of the process, because what we need to do is build a crisis system that works for everyone instead of just a few. The second point here, the second principle, I will point out that the honoring the spirit of our shared humanity did come from Mr. Riddick. And so I think that's really, it's even more powerful now. We thought it was powerful at the time, but it's really important, even like Nikki said, with the policy agenda, that this is something that we need to collaborate on. It's all of ours. It's a collective mission, collective values that we want to engage the community with. And, you know, our overall goal, of course, is to engage communities in a dialogue about behavioral health and raise public awareness and reduce stigma associated with behavioral health conditions. So now we'll tell you more about our 6-month plan. So we're planning to host 24 roundtables with community members. And I know that number is making Dan and Samira's heads spin. It's a really ambitious goal for the next 6 months, but we're very excited to work with all of the partners that we've identified here and with our local jurisdiction subcommittees to identify even more partners that will help us reach community members. But so we'll be doing 8 place-based events. So looking at different areas of each jurisdiction, working with On Our Own of Maryland, who's a fantastic partner to do some at their wellness and recovery centers, 3 with NAMI affiliates in the region, the Black Mental Health Alliance, of course, faith leaders we're going to be engaging as well. And then we'll also have 1 each with youth, the immigrant community, and the developmental disability community. And while we know that these roundtables won't reach every community member and every neighborhood, we're hoping, and our goal is to reach as many people as possible with diverse perspectives and experiences with the crisis system so that we can really get a rounded out view of what people's experiences are, what their mistrust is, why they haven't used the crisis system if they haven't in the past, but maybe needed to, so that, like I said, we can build a system that works for everyone. Next slide, please. Thank you. And then we'll also conduct an online survey. It's going to be brief. We've sort of decided on 2 or 3 questions that we're going to run with. It's going to be very succinct so that community members can share their feedback about the crisis system, share their experiences with behavioral health, just to get even more community input from as many perspectives as we possibly can. We'll also review, of course, existing community feedback that's available, that's been collected by the local behavioral health authorities and others throughout the region. So many acronyms. And we'll also attend community events now that they are coming back and opening up. We're hoping that we'll be able to be represented not just by our community engagement committee members, but also using volunteers and staff from these organizations that have lended their time to the committee to spread the message about GBRICS and get more community input. And we'll also continue our briefings to our current partners and support market research by Marketing for Change, who we're so excited to bring on. And then in early 2022, we'll do a report based on our progress and results. And we'll, of course, provide ongoing updates to the other GBRICS work groups to make sure that our efforts are cohesive. Next slide, please. Thank you. So with all that said, we feel very positive about this, but there are some challenges that we anticipate. I'm sure you all know or are familiar with most of them. This is a very diverse region. And so developing an engagement strategy that works across all four jurisdictions is going to be a challenge. What works in Baltimore City might not work in Carroll County. One glaring difference that we've noticed already in our meetings is that Baltimore City has a really thriving neighborhood association meetings and groups, but not every jurisdiction has that. And so we really will be needing to figure out what will work best in each of those 4 areas. And we feel like we've identified members that will help us do that. We also want to make sure that the efforts in our subcommittee meetings for the jurisdictions don't get siloed, as can so often happen. I'm sure all of us can recall a work group where that happened before. So we're wanting to coordinate across regions and make sure that we are talking to one another and, fostering ideas and really collaborating with one another. We also know that reaching community members who are not connected to formal organizations will be a challenge, particularly in this beginning part where we don't have a shiny new system that we can show off and show everyone. We really are looking for feedback. And so something the committee is really focusing on is how to reach those people who might not be connected to a NAMI or an On Our Own, but their feedback is just as valuable and just as important to this process. And then we'll also work towards managing expectations while promoting crisis services. Of course, we've known that, our system has needed an overhaul for so long. And so there is a lot of skepticism from community members. And we just want to make sure that we're managing expectations about timeline and process for building this out so that we don't set ourselves up for failure, don't set community members up for failure with their expectations for this system. And like I said, we know that there's going to be skepticism. Our goal is to really manage those expectations and, build a system that will make an impact so that we can kind of dispel some of that skepticism. So what's next? Yeah, and since we've developed this, we already did establish the local subcommittee, so we can check that off, which is wonderful. We're also, of course, going to be organizing those roundtables. We're going to be working very hard at that over the next 6 months to get those 24 roundtables completed and get that feedback. We're going to be working towards building new relationships through Samira, who is fantastic. Loved every conversation I've had with her so far. We'll also work with Marketing for Change to support their research and test our messaging. We'll review the draft mobile crisis team standards and hopefully, fingers crossed, we're going to be planning for a 988 transition and an advocacy campaign. And this is just my contact information. I'm so glad to be here with you all. Open to any questions. We're very excited about the progress we've made so far. Oh, I see Katie. Thank you. Katie, you're on the committee. You work with us towards this. Wonderful. And then Sunny, I see you recommend we do one with first responders. That's an interesting idea.
I think that's a great idea.
Yeah.
Thinking 911 call takers in particular are going to have a lot of insight in terms of, what they're hearing from the callers, be it an observer or the client.
Yeah, that's a really great point. Thank you for sharing that.
And Sunny, I'm also wondering if maybe the 911 callers would be a good resource for Marketing for Change as they're doing their market research now. I don't know if others have thoughts on that.
Oh, I love that.
Yeah, we were just a part of that, the 911 diversion training program for the 911 call takers, and they have some stories and some experiences I saw in the training. So I think they would be great. They would have a wealth of knowledge about this.
And also, I don't know if you're looking for a diverse group to sort of touch base with, but the hospitals have patient and family advisory committees. Some of them are specific to certain areas, like at Johns Hopkins, we have a pediatrics one, we have an outpatient one, an oncology one. And, I don't know, some hospitals might have an emergency department one, I doubt it, but, coming and presenting or doing a listening session, doing one of these sessions with a patient family advisory committee or council might be a good way to get that perspective as well.
That's great. Thank you, Nikki. Yeah, we definitely want to spread the word about this project to those advisory committees as well. Any other thoughts or feedback?
A lot of great work.
We have a really great group of people.
And definitely want to Jamie's been fantastic Want to highlight Diane Stallenwork also, who's been with us like every step of the way and helping us to stay organized and frame up these, you know, kind of big questions with diverse groups of people and still be able to facilitate it in a way that we reach a consensus and kind of are able to keep moving on. So Diane's been a big help too.
Diane is always a big help to any project, right?
Yep.
Any other comments or questions? Okay, great. Thank you, Dan. Thank you, Jamie. Sue, were you about to make a comment? I wasn't. Okay. All right. Great. I think just a few updates with regard to sort of the rest of 2021 and the work to be done. We are going to have more report outs like we did from the Community Engagement Committee. We will have report outs from the Comprehensive Call Center, the mobile crisis teams, and then also have an update on the budget, a finance update at the next meeting, which is, I believe, is November 8th. So we'll be doing a deeper dive into those other areas for the next council meeting. But always like to take this opportunity to open this up to the group for any updates that they might have to share, any relevant information. Any exciting projects anybody's working on?
Sure. This is Sunny from the Baltimore City Mayor's office. Just wanted to flag, and I don't know that she's on as a panelist, but Allie Smith from the Mayor's office has been working really hard with BPD and the consent decree monitoring team. Will be later this month, I think September 30th. I may be getting this wrong. We'll be releasing the draft implementation plan for the behavioral health work or the gaps analysis work yep, there you go. September 30th is correct, for public comment. And we'll probably see if we can distribute that to this group as well. Would welcome any comments to make that as strong a policy as possible. But wanted to flag that for this group. There's a lot of important overlap there that we're trying to kind of integrate and make sure that we're reflective accurately of what we're doing in GBRICS while keeping it separate from the consent decree work. So wanted to flag that for everyone.
Thank you, Sunny. Thanks for flagging that. I think it would be great to have that report distributed to this group. Because you're right, there is a lot of overlap. Any other updates or announcements? We don't need to fill the rest of this time, but I did sort of say what we would focus on for the next council meeting. Are there any areas or items that anyone would like us to focus on that haven't been touched on yet? You don't have to call that out now. You could send an email to me or to Adrian, but also if there are agenda items that you would like to see addressed by the council, please, let us know. We're happy to highlight any concerns, issues, things that you want us to highlight. I do look forward, this group will likely remain virtual, considering everybody's calendars and work from across to multiple regions. But I hope when this is all behind us, we do have the opportunity as a group to come together and celebrate sort of all that we've accomplished in the space. And we still have a long road ahead of us, but what we're doing here is pretty exciting. And I always like to say it's really amazing to be part of this team. So thank you all for that opportunity. Thank you all for being part of it. Great. So we will see you all on November 8th at 5 to 7. Adrian, do I need a motion to adjourn or are we good?
No.
Okay, great. Thank you, everyone. Thanks for your time. Thanks for your commitment and your dedication.
Thank you. Good night.
Thanks,
Bye-bye.
everyone. Have a good evening.
Good night.